Thank you. All right. So we started the recording for today's session. Again, welcome on to the California Association of Healthcare Leaders and the ACHE San Diego joint preparation sessions for the Board of Governors exam. So we can go to the next slide. This is our CAHL Advancement Committee. So these are all individuals here that assisted in preparing for these sessions for this spring for 2025. So you will get a copy of the slide and the recording as well, so you can take a look at those team members at your discretion. So we have Kevin here, who's our chair, who kind of led the way for us to put these sessions on. So we could go to the next slide. And Mary, who represents the ACHE San Diego branch. So this is her here. All right, so how do you begin? One of the things that you have to do if you'd like to sit for your ACHE fellow credential, you can log on to ache.org and you'll see at the FACHE, AFACHE. So you have that little tab, and once you get there, it'll have like a drop down for you to start your application. It is really, really easy. I think it's very intuitive as you launch the website and you to start your application. Even for myself, when I started my application, I called the customer service number because I got a little lost with some of the areas, some of the things I had to upload to complete the application process. So there is a form where you can look at the items you have to upload, such as your job description. I even had to show kind of where I sit within my organizational structure. So the different things of that nature, you'll have a form that tells you that. You'll have to upload it as you go through the application process. We're happy to help you as well if you have any questions, but I have to say, from someone who utilized the customer service with ACHE, they were very, 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 very helpful to me when I got a little confused as to some of the steps in the process. But first thing I did was went to the ACHE website, and you see /FACHE. And then you'll get right there where you need to be to start your online application. Doing it online is very easy and convenient. It was very streamlined. So I think that is likely the better approach as you begin your journey. So the next slide. The requirements. So you have to be a part of ACHE for a year. I think if you hit enter again, Jaime, there you go. So you have to be with ACHE for a year, with either a faculty association or international association. You have to have an advanced degree, so a master's degree or higher. Your current executive healthcare management position, you have to be in a management position. Again, if there's any questions about what that means and how you sit in your organizational structure, there's a lot of tools on the website that'll help guide you. As I said earlier, the customer service number that they give you and the individuals that answer the telephone there are very, very helpful. And you have to have a minimum of 5 years in healthcare management. So there's a downloadable healthcare management experience and a matrix you can use that's available. You will get these slides, so you can click on that. So if there's ever a question about something, I think it provides all the tools that you really, really need to ensure that you're ready to that you're ready to complete the application process and take the exam, right? You've met all the requirements that you need. Volunteer activities, between civic and community, I did have a lot of questions around what's civic, what's community, because I'm involved in a lot of different organizations, from AHEMA to AAPC, just a multitude of different organizations, and I volunteer within all those organizations. So I had a lot of questions even for myself, what's community versus civic? So for me, I called the number, and they were able to kind of help me navigate some of those things as well, because you have to have, I believe, two of each. And two of these must be healthcare related activities. So if you serve on any committee, even with CAHL or ACHE San Diego, that does count towards your volunteer activities. But if, as you go through the application process, if you have any questions, you can definitely reach out to us, but also ACHE and their customer service number. I just can't speak enough how helpful they were to me as I was going through the application process. So next slide. All right, and here's the matrix that you can kind of look at to see for your healthcare leadership experience if you qualify. Just kind of a checklist for you as you're going through the application process and ensure that you're eligible at this time to sit for the Board of Governors exam. I'm not this on the matrix of its planning, organizing, staffing, controlling, directing, decision making, financial management, some of the core things in a leadership role that for um, that you're at that as your ability, and getting to the point where you definitely qualify and you want to complete that application process. So the next slide. This is just a little bit more about eligibility requirements for your continuing education portion. So this here, a minimum of 12 ACHE in-person education hours and then 12 virtual to complete that minimum of 36 continuing education hours related to healthcare management. So some of the bigger get some of that in-person, face-to-face. I know that ACHE Congress in Houston just ended, and many people probably qualify for that in-person if you attended that in Houston, Texas. And then you have above maybe qualifying education hours. So you can look at those requirements as well. When you complete the application, all of this is there for you. You'll see it has a lot more instructional guidance as well when you're looking at it. I believe this course is approved for continuing education. So yes, you can use it for your virtual continuing education hours. I did last year when I actually attended these sessions. So yes, anything that's approved through ACHE that we conduct at our local level, at the CAHL level, yes, you can use those for your continuing education hours. You're welcome. So here's just a little bit more on eligible requirements. Prior, so here's two examples of volunteer activities doing at least the last 3 years, and that's the thing, the last 3 years. You can for your volunteer activities. So 2 community and our civic activities, and then 2 healthcare related activities. And so for me, a little bit, I got turned around on healthcare related activities. Like, do I have to volunteer in hospital setting and do any type of hands-on? And no, it just has to be to healthcare. So a lot of the committees I sat on throughout all of the organizations that I actually volunteer for, including student mentorship, and mentoring some of the upcoming professionals in the healthcare industry. So all those can be counted towards your volunteer activities. Again, I had a lot of questions about this when I was filling out my application. Okay, eight qualified education units. So yes, that's correct. So every time we get something approved, you do see it on the flyer. I've seen the comment in the chat about that. Yes. Yes, that's right. So it's different than the virtual. So that would be correct. So, and I think you have to have, you could do the qualified and the virtual. You have to have 36 total. So the qualified and the virtual, if I'm remembering correctly, they can kind of offset each other because you have to have 36. And I think the face-to-face portion is the one that the in person is the that our biggest challenge is with to get all of my requirements to take the Board of Governors. I think the virtual and even the qualified education credits is easy to get. You can combine those to get your 12. But the in-person one is sometimes where I'm a little challenged. And to finish getting all my qualifying credits so that I could sit for the Board of Governors myself. So I'm still needing to get some of the in-person so I can finish all of my qualifications. That's the last piece that I have left. Everything else I completed. So thank you for that in the chat. So 2 references. Okay. So we have our volunteer activity and then our 2 references. So 1 reference is a structured interview from a current fellow. Within our community, we do have people who are fellows that can give you that structured interview. We have people that sit on our committee specifically wanting to do that. So if you need this particular reference, please let us know. We're more than happy to help you with that. From a current fellow. And then the second reference can be from a senior leader, a level executive in your organization. So look, Richard put his email there if you need to, in the chat, if you need to reach out for your structured interview from a current fellow, we definitely can assist you with that. Thank you, Richard, for doing that. And then someone within your organization to also give you a reference. If you need a second reference from someone else, either someone from your organization or another fellow, we can definitely work with you through some of those things. Just again, let us know. CAHL Advancement Committee members, here we go, are open to be your references. So please do not let that portion hold you up for any reason. We're more than happy to help you meet that eligibility requirements. I think for me, as I said earlier, the biggest portion is getting those continuing education units to satisfy all the eligibility requirements. That all the rest, I think we have individuals that'll be more than happy to help you with those. All right, next slide. All right. So here is the Board of Governors exam application process. So complete and submit your online application. All of the supplementary information you need to provide. So a copy of your graduate diploma or final transcript. So honestly, when I called the customer service line when I was completing my application, she said I could take a picture of my diploma, and upload it, right? So I did do that and I was able to satisfy it. I did have my final transcripts as well, but she said it could be just as simple as taking a picture of my my graduate diploma, and that would have been sufficient. So either or, your current job description, there's a place to upload that online, your organizational chart, and your resume. So all of those things are at least a part of the process. Was a little bit easier, and you can look at your management experience to ensure that you meet those areas within the matrix that we showed a little earlier. Your references. So I know for my references, there's a way for them to complete online. So again, the online application is very intuitive. I don't think you'll have a problem with navigating through that process. And then, of course, once you have everything uploaded, it's a $250 application fee. Once that first portion is completed, you've completed all the necessary requirements within the application process, and you pay your application fee. You will receive an authorization letter, an exam registration form from ACHE, and then the fellow application will be valid for 2 years to register and pass the exam. So candidates may take the exam many times as needed during that 2-year application eligibility period. So I think that is amazing that you have 2 years to complete that. There is a 60-day waiting period between attempts, so that's important to be mindful of. So once you get your application, and you've done all these prep courses with us or on your own, there's other tools that will that we will recommend that you can get, perhaps, study guides and different things of that. So you do have some time to take the exam more than once and pass it. A exam registration fee is required for each attempt to pass the exam. I'm not sure how often the exam is administered. I don't have that, but I don't know if anybody else that's a part of the committee has the answer to that. But I'm going to ask Jaime to take your name and we can get back to you on that particular, to give you an answer for that. Okay, it's unlimited. Thank you, Richard. So Richard put that in the chat. It's unlimited at the test sites. So it looks like you could just register within that 2 years. You can retake it. You have a 60-day waiting period between attempts, and it seems like it's unlimited, as Richard has confirmed for us in the chat here. Registration fee for the Board of Governments, $225. And then you can take the within 30 days of payment. And then to select your exam site, so you can go here to the website here, and there's a computer-based testing, and then the paper exam at the ACHE Annual Congress is also available. So there's 2 options here that can take the exam as you go through the process, and it's unlimited, just yes, Richard has provided that answer for us. So here's the outline. It covers 10 core knowledge. See those 10 core knowledge areas here. As we go through the exam prep, we'll go through all those knowledge areas with you throughout the course of our sessions here. There's an interview requirement from a fellow, yes, to complete the application process. There's a chat, so that was in one of the previous slides. Yes, there is an process that you have to go with a fellow, with a current fellow, and then after that you can get a reference either from your employer, senior level, or from, or it could be from a current fellow, and we can help you. But yes, that's an interview has to be done for one of your references, the current fellow. All right, so here's our outline for our 10 core knowledge areas that we have to, that's going to be a part of the exam. You can see the questions associated with each knowledge area and the percentage of questions from that specific knowledge area. Okay, no worries, Cindy. So yes, so we'll, again, part of our prep sessions, we'll be going through all of these knowledge areas to get you prepared for the examination. So we can go to the next slide. Okay. So our exam outline, 230 questions, only 200 are scored. It measures competence, right? Competency, not book learning. So we don't want to memorize things, right? We want to be competent to be able to apply those skills and insights into healthcare environments. So it's about competence and not about memorizing something. We want to assess application of knowledge, not just recall. Yes, that's what I just said. So that's why we want to make sure that you kind of understand the structure of these questions. Some credentialing questions may be recall. They may have a few recall, but the core essence is to be competent, right? If you're holding a credential. So that's the essence of this exam, so that we can ensure everyone that holds that fellow credential is truly competent in those 10 areas of expertise that the exam will cover. So the next slide. Here. Okay, so here are some helpful resources that you can take a look at as you prepare. In addition to these prep sessions, you'll be with us throughout upcoming Saturdays. There's also these resources here. You will get a copy of this, so you can use at your discretion as you continue to prepare for the exam. So you could, so we have those, and these are other helpful links for you guys. There's study sets, flashcards. You can get a bundle. Yes, we will be sending a copy of these slides. Yes. So you'll get an email after each session with a copy of the slides as well as the recording. So you can go back and reference some of these materials on your own, especially these resources, and clicking the links and looking through those links at your own discretion, so you can figure out what additional resources you need to prepare. Yes. Hopefully you guys see the chat. If your name is not displayed, please put your name in that, because we are taking attendance. But if your name is displayed appropriately, we have your name, like someone has iPhone 2, please put your name in the chat so we can take appropriate attendance and ensure everybody gets the material after these sessions. Thank you so much. All right, the next slide, please. All right, what should you expect? So exam preparation, allow 3 to 6 months. I think as a standard for if we're preparing for any type of credentialing exam, 3 to 6 months is always recommended, right? We want to make sure we prepare and hopefully also exam on the first time. Evaluate your levels of skills, knowledge, or competency in each knowledge area. Again, we have 10. So you want to ensure that you look at those competency areas and evaluate which areas maybe you're not as strong in as others, so you can prepare. So you can assess your competencies. There's a link here that will give to you guys, so you can look at that as you continue to prepare. Develop a plan of courses, reading, mentoring in your areas where you may need further skills, knowledge, or competency. Again, we're here to help. There's also these resources here, ACHE and local resources, exam prep slides, sample questions will also okay, so someone tried to click on something and they need access. So if you run into any issues with that, we could put our so the CAHL advancement email address, and we can definitely get back to you if you're having trouble with any of the links. You will get an email from us after this session with the recording and the slides. So once you get that email from us, you can always reply to that if you have an issue with any of the links. Whoever put in the chat that they're having issues, if you want to provide your email, and we can get back to you as well with any issues you're having and clicking on the links. So again, Here is your exam prep insight that we gave you here. I think I was on the last one to develop your plan. And looking at some of those resources and study guides that's out there for you. So next slide. Okay. So what should I expect? So we have this Pearson's Authorized Test Center, so you can click on that. You click on the link, you should be able schedule your exam. So you have to meet all the requirements, right? We talked about that. Submit your advancement application. You have to gain a CHE approval for eligibility. We went through all those steps we have to go through to ensure that we're eligible to take the exam. And we talked through that in the beginning part of this introductory of our exam prep. So that entire application process has to be completed and all those requirements met. Once you meet all those, including the interview, right, the in-person interview with a current fellow, and then a reference from your employer or another fellow, all requirements have to be met. You have to register for the exam and pay that $225 exam fee. There's also that application fee, which is different, right? Your application fee is $250. And then once that's done, once you get your approval from that application fee, you pay that additional $225 for your exam fee. So you want to take the Board of Governors exam here as our testing center that we have here in the link, and you'll get immediate scoring, right? With any type of person's type of authorized exam testing that we do, you'll get an immediate response if you passed or not. Remember, we went through the requirements. If you didn't successfully pass on the first time, you can retake it. You have that 2-year. It is, you do have to wait 60 days after the first exam is taken before you can take it again. If for some reason you're not successful, but we are preparing. So I know we will all be successful here. I'm hopeful we will all be successful in the first time, but if not, there's different steps we can take to retake that exam. All right, the next slide, please. Okay, so here is more references and reviews so you could get that full bundle pack here, it looks like, for $295. If you go on the ACHE website too, a lot of these resources are there. When I was completing my application before I even came to the exam prep, you can see ACHE type of prep books, preparation books or whatever. You can see that on the ACHE website, and you can purchase it there. So I was able to see a lot of those resources online. Okay. Thank you so much. So there's Richard put in a reference. If you only get one in the chat, which one should you get? So we truly appreciate that. Thank you, Richard. So because the whole bundle can be, it's $295. One book you will get. Richard did put the one in the chat that he recommended. So he's been doing this for a long time and helping upcoming professionals prepare. So I definitely take that guidance that he gave us in the chat. Thank you, Richard. All right, next slide. More resources here for you guys to kind of take a look at. You can order the set of these books here as you prepare. And you see the price there for $3. So again, kind of take a look, do your own research, take some of the advice. Okay, some people are having issues accessing the assessment link here. So I'm not sure if it's all of the links or if there's a specific link. So if you guys we'll put our email in the chat, our CAHL Advancement Committee email in the chat, and we can get back to you. If you want to give us your email addresses, we can definitely follow up with you and make sure that you're getting what you need. So please whatever works best for you. You can even do a direct message to our committee members and put email in the chat to everyone. So whatever works for you, we'll definitely get back to you, to the individuals that are having issues in selecting some of those links. Thank you, Teresa and Jaime, if you don't mind capturing whoever puts their email addresses in the chat so we can get back to them on the issues they're having with the links. Thank you. All right, we have another slide here, or is that, okay. So test taker testimonials, it's always nice to get testimonials from individuals who have already taken the exam or and went through these preparation classes with us, these prep sessions with us. So you can see one of our testimonials here from Michael Felder says that it helped him tremendously, right? These prep sessions helped him tremendously as he prepared for the examination and now has his fellow. So we just wanted to give you insight of other individuals who have testimonials for us and who have completed taking the exam historically. Here you go. Here's our wall of fame of test takers. All right, go to the next.
All right, this is the last slide of this section. Let me switch over to part.
I think Richard wants to share now.
Okay. Hi, everyone. I'm going to share my screen if I can just find where I lost it. Oh, here we go. So I want to spend some time talking about the test taking technique in terms of how do you answer questions, right? And one of the things that we've been really successful in the past on this is not just talking about the content areas, because really we don't spend a lot of time on the content areas. You can't in 1 hour learn everything you need to know about each topic. So what we're trying to do here is you a better test taker. And that's what I'm going to spend the next few minutes on before we get into the healthcare. So obviously to take the Board of Governors exam, you have an advanced degree, and it's pretty much impossible to get an advanced degree without having taken a whole bunch of multiple choice tests over your life. You need to learn the content, but my argument is that if you have good test taking technique, it's going to improve your chances, right? So that's what I'm going to do. And as we get into the topics, we'll also walk you through these. We start with time management. There's a feeling when you sit down for a time test that you start panicking, and I think everyone does that. So my first advice is slow down. You've got 6 hours to take this test, and I don't know anyone who's taken anything close to that. You've got 230 questions, including the 30 test ones and the 200 that count, and you don't know which is which. And if you like doing long division, you'll find out you have 93.91 seconds per question, about a minute and a half. Just to put that in context, the bar exam for attorney gives you 1.8 minutes per question. And the licensing, U.S. medical licensing exam gives you 1.5. So you got a little bit less time than attorneys and a little bit more time than doctors. Regardless, it's really, really, really plenty of time. And that means you have time to analyze your questions and you work your way through them. You should not feel rushed. Like any test, some questions are tougher than others. You know some areas of these better than others. So keep in mind that you can mark the question on the computer and then come back to it, right? So one thing some people do is say, okay, if I know the answer, I put it in. If I don't know the answer, I'm going to mark it, come back later. Or if I'm flipping a coin because I'm not really sure which of the two is right, um, get the low-hanging fruit, get the easy ones, come back later for the hard ones if you're feeling stressed by any of the harder questions. Okay, so let's get into specific questions. How do you deal with specific questions? And again, remembering that you got plenty of time, spend some of that time just staring at the question and trying to ask, what is it that they're trying to get here? What are they aiming at? So with each one, get context first. In your mind, is this finance? Is this business? Is this quality? And some of them are straightforward, obviously, which one it is. Some of them are not necessarily. So kind of get your mind aiming at the part you need. Then uh, eliminate the parts of the question don't apply. Some of these are really, really, really wordy. They put a bunch of things in there that really aren't part of the question. And what I do is actually in your mind, rewrite the question to make it more specific. As you're doing this, look for negative words. All except, not, things like that. Because when you scan over, those words are sometimes easy to miss. And then, of course, you've got the wrong answer. So one technique people have used is to read the question backwards. Read it word for word, looking for the negatives. And then also look for keywords like most, less, least, or best, because sometimes there's more than one multiple question that's or answer that's correct, but you have to pick the best one. So make sure you know which one of those words it is. Let me give an example here. So this is a question that you might find. The process of strategic planning requires development of a plan that. Most people, when they read this, are going to start with the process of strategic planning, and you put your mind into thinking about the strategic planning process. If you do that, you're either going to be looking for the wrong answer, or even worse, picking the wrong answer, because if we cross out that first part, the process of strategic planning, what the question is really asking is about the plan itself. It requires a plan that. So maybe we need to just rewrite this and this is strategic plan do, right? You don't have to write it down, but in your head, you get that. And then you can start looking for answers to that revised question because you got rid of all those other parts. Here's another one. This is, to me, just a really distracting extra words here, right? As managerial vacancies occur, the availability, well, that's a lot of words. What do I need to know here? What am I looking for? Well, maybe I can just reword it this way. How do I improve the availability of applicants who know us? I got rid of a ton of extra words there that will then help me zoom in on the possible choices that I'm going to look for. All right, so number one, analyze the questions. Number two is instead of looking at your question and saying this is a multiple choice where I have 4 options and I have to pick the best option, instead, think of each of the answers, each of the potential answers as a true-false question. So you really have 4 true-false questions to answer, and go through each one, back to the Peppermint Patty Peanuts cartoon there. You're going to go through and do true or false for each one. Hopefully, in a perfect world, you'll easily have 3 false answers, and then the remaining one is the one that has to be true. And you call this the Sherlock Holmes approach, because Holmes told us that when you've eliminated the impossible, whatever improbable must be the truth. So the goal is get rid of 3 that don't work, and that means that the one that's remaining is the one you're going to use. Remember, though, that some are asking for most or best or least or some other descriptor like that. So you can up with more than one true, right? So if you've done that, say you've got a true, false, you got rid of the falses, right? Now picking between two truths, and that is going to make your life easier. Okay, it's better to pick 2 out of 4 than 1 out of 4, right? So using this approach will help you to define the correct answer, even when you're not totally sure what it is, right? Because there are times you just don't know the answer. None of us are strong on all 10 of the areas. And the result is some of the times we're almost guessing. Well, that's okay. If you can eliminate 2 of the 4 that you can figure out are false, that's right. Move on. Guess, flip the coin, whatever, for the remaining 2. And what 1 out of 2 is a lot better than 1 out of 4 if you're guessing. So I'm going to try a example here. So here's a question that you might get asked, and you see the 4 choices. And what you're going to do is you're going to say, okay, well, I'm going to just look at that, look at those, and what am I looking for? I'm looking at a finance question. What do I need to know? I need to know about financial incentives and reducing costs. Those are my key words that I'm going to be looking for. I'm going to rewrite it then. I'm going to say, well, what reimbursement method reduces or promotes reducing cost? Right? I've reworded it in my head. I know that to answer this, I need to know something about how we all get paid in healthcare. And more important, I need to understand the incentives, the economic incentives. And as I look through this, I don't see any negatives, but I do see a qualifier, the largest financial incentive. Right? Now that's telling me I'm probably going to have more than one true answer. I'm going to which one is the largest incentive. I've looked at this question ahead of time, and it's given me the context for how I want to answer it. Right? So here's my reworded way of looking at the question. And I had 4 choices. The first one was charge-based. Well, charge-based, does that reduce cost? No, charge-based actually ends up increasing the cost, right? At least it certainly doesn't reduce it. So I'm going to call that one a false, crossing it out. My second choice, cost-based. Well, no, cost-based, if you're getting paid as your based on your cost, then increase your cost, you get paid more to some extent. Yep, so that one's a false, crossing that one out. Prospective payment, yeah. So by determining the payment beforehand, if you can keep your cost down, yeah, you're going to make more money. So that one actually sounds pretty true. I like that one, but I'm still going to look carefully at the 4th one, right? I make the mistake of jumping into an answer. I want to give each of them a look, and it's per diem. And per diem is tied to the number of bed days. So if I have more bed days, I get more money. That's going to increase the cost. If I could reduce the bed days, then yeah, there might be some savings there. So this one's kind of true, kind of false, mostly false, I think. But even if it's true, it's not really as good as the prospective payment one. So I'm going to stick with the prospective payment one, put that down as my answer. And I've taken the time to analyze it here, through each of the answers, looking for true and false. And this is going to help me get more likely to the true answer. Okay. I wanted to deal with one other issue before we move into healthcare. And if you're like me, your absolute least favorite questions are the ones that have lists like this. So they might ask about the steps in perspective in strategic planning, or like this example, the continuum of care. And I hate these as I just get confused. I've got to go through each one and I've got to look each one in the right order. Well, the best way to do this when you're dealing with one of these is add one more step. So look at the word choices there and identify which one has to be first or which one has to be last or both. And when I do that, I look over all the things here and okay, well, primary care has to come first, right? Of all the ones listed. So therefore, I know I'm going to look for an answer that has primary care. There's only one of them, fortunately. And I can confirm it because office is going to be at the end, which also makes sense. And that means that I've made more sense. I've done a true false still, but by looking for the correct starting point of the sequence, I've hopefully kept myself from going crazy and gotten to the right answer. Okay, so that's a real thing. You're gonna see us practicing this as we go through the topic areas, but it does take practice. So I really encourage you as you're doing your own preparation, find questions you can use. We have some, ACHE has very little, there's others online, but technique of doing the correct analysis, doing the true false. And what you're going to find is that you're answering more of your questions correctly, slower, but more correct. And with that, I'm going to stop sharing the screen. And again, you're going to see us practicing this. I want to move into talking about healthcare. And I'm going to introduce Lauren. Lauren is a policy analyst with the California of the American College of Healthcare Executives. She's also a faculty member at California State University, Chico, along with me. And she is currently working on her doctorate in health administration, focus on health policy, teaches Chico's class on healthcare delivery system. So she knows these questions pretty well, I think. And I will move ahead with our question. Lauren, are you ready?
I'm ready.
You are ready. All right. Whoops. Oh, well, there's the introduction of you.
Here's me.
Next. So I'm not going to read this part. These are the things that you can read yourself. They're on the ACHE website about the topic areas for each one, the details of each one, what you want to know to be able to answer these. So please do take a look at those. Next slide. Next slide. Oh, we're going to keep going. Okay, so here is our first question, Lauren, for this.
Ready.
Okay, Lauren is going to work through it and show us what's going through in her mind as she's looking at this question. Did you look at these earlier, or did you cheat? All right, so you're looking at them and you potentially can get them right.
Yes.
It happen, but hopefully not. So let's find out. Okay, so improving provider service network that contracts with employers on a capitated basis, but pays providers on a fee-for-service basis. Let us into your brain and tell us what you're thinking.
Okay. Lots of extra work. It seems like I'm trying to improve profit for an organization on a capitated basis, which means they're getting a flat rate. So they want utilization to be low, and they pay providers on a fee-for-service basis, which means they're paying for utilization. So my right answer is going to be something that reduces the amount that of procedures happening each month. So right off the bat, I'm going to say A is false. Increasing procedures is going to increase the amount we have to pay out, but it does nothing for what we're bringing in. Reducing per member per month rates to employers is false. I don't, off the top of my head, I don't know that really does much. If anything, that's reducing our profit and less money. Increasing payment rates automatically going to cut into our profit. So false, which leaves D having to be true. So reducing utilization, I imagine it should be reducing utilization of service. So I'm going to say the correct answer is D.
And let's see what is, and she got it right.
Woo!
All right, good. Let's go to another question then. You're on a roll. See if we can go two.
Okay.
Which of the following is true about a capitated managed care organization arrangement?
Okay. Capitated managed care, again, I know because one of the things I need to know is some basic healthcare terminology, that capitated is per patient, it's not per procedure. The entire purpose of managed care organizations was to shift risk from insurance companies, shift risk away from insurance companies. So I know A is false. Providers billing separately for each service is the exact opposite of capitation, which is more per member per month rates. So B is false. Provider must wait to bill the MCO until services have been provided. Again, that goes against the definition of capitation. Per member per month means they get paid every month, regardless of if they see the patient. So once again, I am saying D.
And once again, you are correct. Which of the following is not one of the reasons that HMOs and PPOs have lost traction in cost containment in recent years?
Okay, first thing that stands out, there's a negative here. There's a not in the beginning of the question. So I need to make sure that I don't let that trip me up. So HMOs and PPOs are about, they use utilization control for cost containment. So I'm going to look at my answers. A, new technology and pharmaceutical products have affected the amount and types of services being demanded. I know that to be true, but because this question is a negative, that means that A is probably not my right answer. Increased payments as a result of physician and hospitals' ability to consolidate and mobilize negotiation leverage. I also know that's true, which means it's probably not my right answer. Consumer and provider dissatisfaction, forcing government intervention into managed care. Off the top of my head, I don't know if that's true or false. That's maybe true. So I'm going to look at answer D, which says the Affordable Care Act banned HMOs and PPOs. And I know that's not true, which would make it my right answer. So for the third time in a row, I'm saying D.
And do you want to just go with D for the next one, or do you want to actually see the question?
I mean, I should probably see the question. It's how
I
they
one
get.
time gave it a quiz and I had 3 Ds in a row and someone changed it because she didn't think I would do that order. So don't, the computer, by the way, does do them randomly. So there's no patterns. You can't look for it that way. Let's see question number 4.
How is ambulatory care delivered? So this is really just, do you know the definition of ambulatory care? What is ambulatory care? Answer A, medical staff membership, does not make sense in the context of the question. So crossing that one off. Same with patient preferences. It doesn't make sense. So I automatically know it is C or D. And I feel like this is the other way that these questions try and get you, is they're either going to be really wordy in the question or really wordy in the answer. And this is one of those wordy answer questions. So question C is, in community-based settings, ranging from home to physician offices to clinic-based settings, or in outpatient or emergency departments of hospitals. That sounds correct to me. Ambulatory care is care you walk in and walk out, which would be outpatient. But I want to look at D just to make sure it's not more true. And it appears to be the exact same answer, but it says inpatient instead of outpatient, which is incorrect. So I'm going to break my streak and I'm going to say C instead of D. And Trisha in the chat is on fire with her guesses too.
They're not guesses. She's analyzing and coming up with the correct answer.
You're right. I should have given Trisha more credit.
Please do. Let's take a look at C and D again, though, briefly, because they both start out exactly alike, and that can be really confusing. You have to dig a little deeper. So maybe just eliminate the part that overlaps. Physician offices, clinic-based, yeah, those are fine. In D, you've got acute care facilities as well as inpatient. So don't let the similarity at the beginning distract you. Look at it to say what makes them different. And again, slow down. You got plenty of time when you get something like this. Next.
Oh, GME. I love GME questions. The cost of graduate medical education are of concern to government policymakers because. So looking at this question, the simpler way to ask it is, why does government care what we spend on GME? So answer A, the number of residencies and residents are not centrally. All right. B, the number of medical school graduates exceeds the number of residency positions. D, managed care organizations are relatively uninvolved in the payment of GME. And D, many residency positions are filled by foreign graduates. So I feel like to get this question right, you have to know a little about how GME works. And the GME is largely funded by the government. They pay extra money for GME organizations. So the number of graduates exceeding the number of residency positions doesn't impact how much government's on GME. Managed care organizations being involved or not involved doesn't impact how much government spends on GME. And residency positions for foreign medical graduates, it costs the same whether they're foreign medical graduates or regular medical graduates. But if the government is paying for GME, if the number of residency and residents aren't controlled, that means the amount they spend goes up. So I'm going to say A.
And Tricia didn't go in this time. She didn't answer, but I bet she would have had A too. So let's go back on that one if we could just a second. This is the previous slide. There we go. This is an example of one of those areas that you may or may not know. Lauren knows a lot about graduate medical education because she's for a physician interest group, but most of us on a daily basis really don't think of how residents are paid. So this may be one of those ones, you say, okay, I'm just going to guess. I don't know it. And you're not going to know everything. So you can improve your odds by decreasing the choices, by doing the falses, but there's some things like this you may just not know the answer.
And I feel like these types of questions that require you to have rote knowledge, because like it was mentioned in the first part of today's presentations, they want to see you apply things. They don't just want to see you have things memorized. So I feel like they try and restrict the number of questions that are like this that require a very specific type of knowledge, specific area.
Restrict them does not mean eliminate them, though, so expect to run into some.
And you don't need to get every question right to pass. Keep that in mind too.
Let's go to number 6.
Oh, acronyms.
TLAs.
The following is a unit of measure commonly used to determine physicians' clinical activity. Okay, I know this one right off the top of my head, but well, I'm going to start at the bottom and work my way up. D, CPU, is computer processing unit. Doesn't have anything to do with productivity unless you're a computer. C, IPA, is India Pale, which you might while you're taking this exam, but I don't think that beer is going to help your physicians be productive or measure your productivity.
How about Independent Practice Association, though?
You know what? Mine's more funny.
It is, no doubt.
And independent practice associations also aren't a measurement of clinical productivity. CMS, Center for Medicare and Medicaid Services. So much like the chat has been popping off with, RVUs, relative value units, would be the correct answer.
This is an example of you just have to know it. You have to not only know the terminology, but you have to know some of the 3-letter acronyms, the TLAs. And a lot of us just deal with these day to day, but there's some lists available, and just spend some time going through it and make sure you know which ones may show up like this. Next one.
Which population demographic factor is currently having the greatest impact on healthcare organizations? Okay, well, one of the things that stands out to me here is demographic factor. So looking at these 4 answers, I don't technically count as demographic factors. I don't know that I would consider insurance coverage a demographic factor. And geographic distribution, again, I'm not sure that's necessarily, well, it could be. I'm 50-50 on if that's a demographic factor. Age cohort, definitely a demographic factor. Something that I know impacts healthcare organizations a lot. Ethnic composition, also a demographic factor. Has some impact healthcare organizations, But because I'm looking for it, it's got that greatest in it, I'm going to say age cohort. I feel like age more of an impact on utilization of care than ethnic composition or diversity. Tsunami all the way.
And it looks like you're right.
Love it when that happens. Being right is my favorite.
Let's go to number 8. Ooh, lots of words.
Oh, lots of words in the question and the answers. Public reporting of outcomes information has become a high priority for healthcare payers because, all right, answer A.
But what are you looking for on the question?
What I'm looking for question is, if I'm a healthcare payer, why am I sharing my data? Why is it important to me to share my data? So measurements of performance have now become well established, standardized, and accepted by all parties. I don't think that's true. And even if it was, that wouldn't make sharing the information a priority. So the answer, I don't think the answer is A. B, purchasers are pressuring for disclosure of meaningful performance information for use by buyers and consumers. So I know to some extent that's true. The ACA required a lot of like reporting for each CAHPS, CAHL, hospital compare. So that could be the right answer. Consumers in healthcare are now well organized, and managed care organizations feel a need to satisfy them. You know, in my dreams are consumers well organized and know what they want. That is incorrect. And physicians are increasingly encouraging their patients to evaluate their insurance plans based on publicly reported data. I have never had a physician ask me about my insurance for anything other than figuring out how they're getting paid. So I'm going to say the answer is B.
And it sounded like you weren't totally happy with one, but it was the best of the 4.
Yeah, I mean, I think a more straightforward answer would be it was mandated by the government, so they don't have a choice. But of the 4 answers, it seemed the most correct. If you had asked me this question as a short answer versus a multiple choice, I don't know that I would have used the exact wording they used here, but because I looked at false, I felt pretty confident going with the answer B.
Because the other 3 were definitely wrong.
The other 3 were categorically incorrect.
All right, let's go to number 9.
Health savings accounts were established through which law? Ooh, okay. I feel like this is another one where you have to kind of know. Like it's not one that you can logic your way through the same way that we have some of the other ones. There are some things that I can immediately eliminate, if only because I feel like they're older than HSAs. So I don't think the answer is D. I don't believe that the Americans with Disabilities Act established HSAs. I know a lot about HIPAA, and I'm fairly certain it's not C, which leaves me with A and B. COBRA is tricky. The policy nerd in me knows there's more than one COBRA. So the fact that a year isn't listed here raises a red flag, because there were several COBRAs that were relevant to healthcare, So I'm gonna guess B. Ah!
And it looked like interesting in the chat. We had two people put in B and one person A with a question mark. And the question mark is always the issue when you don't know the answer because you have no idea where. Um, if you can eliminate them, as Lauren did with, no, this definitely wasn't part of HIPAA, and ADA had nothing to do with it. And that means you've got to two of the four. So even if you're flipping a coin at this point, you're better off two out of four, or excuse me, one out of two instead of one out of four.
And that really was, basically a coin flip for me. The only reason I guessed B instead of A is, like I said, the not having a year on Cobra was a red flag for me. I didn't know prior to this question that the Medicare Prescription Drug Improvement and Modernization Act established HSAs. I do now.
Well, and you really get it from the name either. The name is not a hint on this one. It's just sort of hidden in there. Cobra is another one that, people don't realize Cobra is EMTALA, or EMTALA was a clause within one of the Cobra laws. So some people will talk about emergency departments having to treat patients because of Cobra, but you do want that.
And then Cobra was also insurance coverage during it's the gap between insurance and employment. So
let me point out two things on this one. One is that you see this is listed as a question, and you might say, well, why isn't this a law question? There are a bunch of questions that are not really cleanly in one category or the other, and you just have to go with it. The categories are nice for preparation, concentrate, but the questions themselves certainly do overlap the areas. And in the test itself, the areas are not labeled in terms of the questions. So you'll get 200 questions and they are spread out by percentage, but you could end up with 5 finance questions. Please don't kill yourself if that happens. Just answer the question slowly. Tricia says she changed her answer from B to A, making it the wrong answer.
that's one of my favorite things about one of my favorite pieces of advice about test taking.
Go for it.
I'm an overthinker.
Really?
You know me, they don't. I'm an overthinker, and I have found that my gut reaction with questions to be my best bet. There's mixed research on whether or not is actually factual for all tests. But I try to avoid changing my answer as much as possible, because sometimes, especially when you're not sure about, maybe there's something in your brain that picked that first answer for a reason. So don't let the perfect be the enemy of, try and stick with your first guess as much as you can.
Usually.
Usually.
Not an absolute rule, but yeah, usually you're going to be better off with it. Number 10.
The demand for nursing care is a function of 2 elements. Okay. The number of patients and the number of physicians on staff. Number of patients seems accurate. Physicians on staff, I don't think I agree with, but I want to see what my other options are. The number of patients and how sick they are. Okay, I like that one a lot better. The number of physicians on staff and their specialties. No, that doesn't sound right. I feel like the number of patients definitely has to be involved. And the number of PHO and HMO contracts. No, that doesn't impact nurse staffing. So I say B, and apparently so is the chat. We're in agreement, B.
This is an example also of a question where you may read the call of the question, the demand for nursing care is, and answer it in your mind before you look at the answers. And that may help also because, you've got two different factors in each of them. And the number of patients shows up a couple of times. So that's kind of like a list. You can say, yeah, it has to be that. But then you also have the physicians on staff, including A and C, and you can use, if you've eliminated once, you can kind of.
Yeah. And Trisha in the chat brought up nurse staffing ratios, which I just want to make clear is true for California, but isn't necessarily true nationally.
Yeah.
And the Board of Governors exam is a national exam. So you want to make sure that you're paying attention to national level policy, not just how we practice here in California.
Although if you leave NLN in long enough, we may get it nationally, but so far we don't. Number 11.
Well, I feel like this is cheating because
Yeah, no, it's got different answers.
Okay. What is the order of the healthcare continuum? All right. We have A, long-term, acute, palliative, primary. So if those were the four options and it was the only four options offered in this, I would say no, it's not in an order that makes sense either backwards or forward. Long-term and primary makes sense. Well, but palliative should be my end point. B, pediatric, medical, surgical, acute. That is 3 specialties and level of care. So it's not B. Primary, acute, long-term, palliative. Yes. But I'm going to check D just to be sure. And a C, the D has surgical in it, which is a C. So I'm going with C. And it looks like the chat concurs. And we are right. Go chat. Woo!
Okay, so what if they listed it as, say, neonatology, pediatric, internal medicine, and gerontology? Could they do it that way as the age continuum instead of the care continuum? Would that also answer it?
I don't think so, because when we talk about healthcare continuum, it is about care. And within each of those specialties, there is outpatient and inpatient.
Yeah. So the age group for the patients really is not what they're asking for. They're asking about the healthcare being provided.
Yeah, you can have, 89-year-olds receiving primary care and toddlers receiving palliative care.
Yeah, and as someone actually is pointing out that palliative and hospice are not the same thing.
They're not.
If they both show up there, you'd have to think about that. All right, I think we got a couple more. Let's go to 12.
Your board of trustees has terminate the privileges of a physician. Which of the following organizations must you inform? Okay. This is not my area of knowledge in any way, shape, or form. First, AMA. My gut says no. AMA is a private organization. They aren't a governmental body. So I don't think so, but we'll come back to it just in case. Local medical society. I'm also thinking no, because again, local medical societies, private organizations tend to be under the umbrella of AMA. Practitioner data bank. I vaguely remember reading about this in undergrad. It sits well with my gut. And then JCAHL. JCAHL doesn't feel like that type of organization. They're not looking at those types of things. Understanding of JCO, at least on they don't need to know the specific position that's been terminated. So I would say C. And I see we have A's and C's in the chat.
Let's find out. It is C. Yeah, not only are AMA, your local medical society and Joint commission not government agencies, so therefore, go back to the question, which of the following organizations must you inform? Must is a key word there, right? So it's not like, oh yeah, it'd be nice to tell them. You have to. That implies to me a legal requirement. So eliminating non-governmental players would be one thing. Keep in mind that I forget what percentage, but it's less than 50% of physicians belong to the AMA.
Yeah, I was about to mention that you don't have to be a member of the AMA or your local medical society, which would make having to tell them someone got fired kind of counterintuitive.
Yeah, and Joint Commission also, people forget that it's only one of the potential accrediting bodies. There are others out there. And some hospitals, probably most hospitals, I think, still go with Joint Commission. They don't have to. So you can eliminate those just as being inappropriate on the must, which would leave you with C, even if you didn't know that you're required to both report to the data bank, and then when you're preventing someone, you have to check that, see where they've lost their privileges. All right, I think we got one more. We do.
Oh, Medicare. Which Medicare plan allows enrollees to participate in private health plans? This is my opportunity to prove that I know more than Robert F. Kennedy Jr. Part A covers hospital services. Part B covers physician services. Part D is drugs, which means Part C is going to be the right answer. But Part C isn't answer C, it's answer B. Part C is Medicare Advantage. And I don't know. I really like talking about Medicare. So my submission is B, Part C.
And you are correct again. That is a little confusing, isn't it? Making it, A, C, D, B instead of just A is A, B is B.
But the computer is going to randomize all of the questions. So this is something you could run into. So make sure when you're answering that you aren't like, because I knew the answer to this question right off the bat, hadn't taken a second to slow down, I would have just been like, C, the answer is Part C. And I would have made that same mistake.
Yeah. As some said they did. Lauren, we got 1 minute left. What is your best advice on how to prepare for this section?
I think in terms of figuring out what content, what the knowledge area, practice really is the best way. You can't read everything that you need to read and, have a life and go to work and get this down. But practice questions, especially from reliable sources, you're going to start to pick up on trends, and you're going to start to pick up on content you didn't know otherwise. So I would highly recommend practice questions. I've done standardized testing. It really has been the mobile. It will help you practice how you're analyzing questions while also reinforcing those knowledge areas too.
This is probably the broadest of the 10 areas in terms of the number of different things that you have to have some understanding on. I think just even picking up on the terminology, just making sure you know what the data stand for. And in the chat there, we've now got the link to those competencies that we went over quickly, didn't really read through. Someone's asking, is there a question bank for practice? And the answer is, sounding like an attorney, well, it depends. When I took the bar exam, there were literally thousands and thousands of questions available to me We don't have that for here. And that is a problem. ACHE used to get more questions out. They don't anymore. So we have some that we'll share. There's others online that you can find. We don't always know the source. There is now a book that I don't have a link for, but it's on Amazon for test questions or practice questions for this. And I've gone through it. The questions look pretty decent. So if you're looking for questions, that might be one. If you look at textbooks, the back of the chapter where they have to yourself questions, those are always a good one. But it's something I wish we had more test questions available. Okay, we're 1 minute over. Does anyone have any other major questions? Well, thank you. Thanks for the comment, Joe. We'll keep doing this. Obviously, in the other sections, we're going to do that brain walking through, breaking the questions down. And if you come out of here with one thing today, it's slow down. You got plenty of time to really figure the questions out. And that's what's going to make you successful in that. So from the moderators, do we have anything else before we go?
In the links that some people had that was not working in the chat, I put the full resource page from A where you'll find all those books. Some of those links were not working as well. I'll work on the slides and try to get you the exact link to those exact books, because the link I put is to all the resources, but I have to go through each book to give you that specific area where the books are, but it's easy to find. And that's the only things that I wanted to kind of bring forward that the last two things I put in the chat. Thank you.